And some Nigerian doctors in Saudi Arabia, the United Kingdom, and the United States of America have knocked the federal government for its alleged failure to invest in the healthcare sector. The doctors say the inconsistency of the government to adequately cater for the needs of medical practitioners has led to a massive brain drain in the health sector. Some of the doctors, while sharing their experiences, say they cried and felt overwhelmed when they received their first wages, which some of them described as being 10 times higher than the wages in Nigeria.
Well, to take a look at this development, Arise News analyst Dr. AMADI joins us now. Dr. AMADI, thank you so much. And of course, it's almost going to get into a month since the resident doctors, who we know are the backbones of any medical institution in Nigeria, have been on strike. And just this week, the federal government said it was going to enact that no work, no pay, which it will backdate to the 2nd of August when the strike started. And now the umbrella body, the Nigerian Medical Association, has now placed the government on notice. But let's talk about the implication of this lingering strike on not just the healthcare sector, but Nigerians who are suffering from the ongoing impasse between both the federal government and the doctors.
Absolutely. I think the major point is what happens to citizen welfare. Don't forget, it's a time of COVID. Even though there seemed not to be too much public commitment like before, we are still dealing with COVID crisis. And so to have the medical system in this kind of almost comatose state. I went to the hospital during the week for eye issues. Only the consultants will come and go, because without the resident doctors, who are the backbone, like I said, the consultants cannot deliver the services. So you have a medical system that is already short-staffed. If you look at the ratio of doctor to patient in Nigeria, far cry from the World Health requirement. We're talking about not more than 75 to 70,000 doctors with a population of 120 billion people. So the ratio is almost like 1 to 202,755 person, where the WHO is about 1 to 600. So you're already under provisioned in terms of patient to doctor. And now you have doctors not being available. We don't have the alternative medical system is collapsed. So essentially, what we are seeing now is that avoidable deaths are happening. For anybody who is close to the people know that many of the deaths probably are connected to the speed of medical care is low, because you really have to have consultants or the person who can provide for private medical care. The public health system is not working anymore. So this is a big dent. Then if you go back to the socioeconomic impact in terms of what poor access to health has to do with productivity, has even both at the private and public level, and even how it figures into the GDP and getting the economy working. That also has a major dimension, and that's why most people have argued that Nigeria, even the World Bank analysis of how we are coping with the COVID mitigation plan says, look, put more focus on health. Health is a driver of well-being. Health promotes productivity. So we are in a position where we don't have enough doctors, and the ones who have, like reported from the story, are not incentivized enough, and I think they are not even available to work, or probably seeking various means to leave the country. And with that, the level of, since 2014, we've seen almost a doubling of the level of exodus of doctors out of Nigeria. In a way, some people say it's good for them. Those doctors are being paid well, getting better services. They have environment to use their skills. But the impact in terms of healthcare is huge here. Even though one can argue that conceivably we can have a brain gain when, with the use of technology, telemedicine, some of them can come back and support the medical support. In the short to medium term, it's a major loss. And the question is, why are we going to go to this circle again all the time? If the NMA goes ahead with this 21, it will be a total collapse of the system, because they're going to go, this is a holistic.
I was just going to ask you, the implication of that and the brain drain on Nigeria. Isn't Nigeria's health sector, inching towards a comatose
because if you want,
situation?
The minister spoke, I think 2 years ago, he says, look, we have many doctors. If you deliver, that's not true. Again, when I used to be in the US as a grad student, many Nigerian doctors, you see them in all the research institutes. They already become like a contingent, well respected. Our professors are, most of them are out of the show, working to improve health and research. The question about doctors is not just that they are primary health providers, the physicians, they're also research experts. They are also they're consultant and researcher, medical researcher. So if you have your most qualified doctors, and by the way, brain drain takes the best out. So what will happen now is not just that people are moving, is that it's sorting out. The best are going. Those who will help you to improve both the research and the price of medicine itself are going out. And so the impact in the short and even long term is huge. And again, you now see many Nigerians being Bennett, Omalo, people talk about those who discover vaccines. They are Nigerians outside the country, those who work hard on the vaccines. But here, our systems can produce those, even converting herbal resources to vaccines or drugs. It's difficult for us. Why? Because the best of the best have left. And the best that are coming from the pipeline, coming from the medical schools.
All they are thinking about is the rise of OET.
Exactly.
And Nigeria.
In fact, one lady in my office, she's working day and night, a doctor, she comes to read every day. She wants to do the exam and pass. They're paying 2 million, 3 million to just get that pass.
But would you blame the doctors when you have a medical doctor who is the Minister of Labour and Employment, Chris Ngige? Back in 2019, let's not forget that interview he granted. He said we have enough doctors in Nigeria. Anyone who wants to leave can go. Put that side by side with less than 10% of our national and even state budget is actually dedicated towards health. How can we improve with all of this that are actually drawing us back, despite the fact that we know that we have less and less doctors every single week, with 7 being reported to be exiting the country every week?
Absolutely. And by the way, it's a very unfortunate statement. That's just no way we can have. If you look at the data, only 75,000 doctors as at 2018 in a population of 200 million or so. So basically, the minister got it totally wrong. Again, even if we have enough, even if we are so full of doctors everywhere, why should the country celebrate that its doctors are walking away, not from a sense of further research or scholarship, but primarily to exit the condition? And so what I think we should be doing at this point is a couple of things. First is there's a sense in which there should be a bigger commitment to health services. The problem is that health doesn't seem to be tangible in the short term. So people talk about why should we invest 20% of our resources to health, where we could invest it in middle rails, road, where contracts be awarded. I mean, part of the health, most of it goes to personnel, goes to research, not tangible things. So the government has to learn that these intangibles are the critical drivers of the tangible things you get in the long run. So there should be a sense in which more investment goes to the health sector. The second issue is around policy. You see, there's a sense in which also we need to open up the space for private sector investment. Government need to be supported to run public health. And as we saw in the COVID with countries all over the world, developed economies, failure to improve public health gets back to hit you. Takes a revenge.
Yeah, and how has the NHIS improved, the health sector in Nigeria?
Not much, because if you look at the number of people who are also enrolled, I mean, the enrollment scope is low. Even the what it covers is still low. And even administration process of the NHS is also very problematic. So you see people who can't, the basic things today all over the world, things like maybe cancer screening is no longer high-end medical care. With the level of cancer deaths around going on every day, you need to cover, but it doesn't cover most of those things. So the NHIS has not worked in the sense of you need to be funded properly. The financing of healthcare is a critical one, because not just all over the world, the business are going to contribute. Even workers who are going to benefit from those have to contribute more. But in the economy where the minimum wage is almost nothing, how can you ramp up contributors' portion of the National Health Insurance Scheme? So the financing is difficult because you don't have public support that's big enough. You don't have incentive for private sector to get involved too much. And even those who are enrolled, their disposable income, their takeaway is so low that taking a little bit more to create that financial pot from which private healthcare providers will be incentivized to provide more efficient and broader coverage. Don't take. So the financing needs to be worked out clearly, and they can't do that with the government that's not ready to bite the bullet of right-sizing governance. The cost of governance affects public disposable revenue for health and education, and that's why we're having proportional contribution.
And of course, we have to look at how all of this crisis, especially in the medical sector, with the doctors on strike, and even more eminent, if the enemy joins, that means the consultants as well will be after hospitals. Everybody. That means everyone will be left to the private hospitals. But How does this crisis really affect economic and social development, especially for the poorest of the poor in the country?
First is that if, for example, the public hospitals are not working because of, for example, resident doctors are not there, it means that people have to pay more to access maybe the private hospitals that could still open their door for Medicare. And that means you're taking a chunk of income from other critical rent, feeding, that compound morbidity. So essentially, Nigerians are actually spending more for less. That's one impact on the economy at the household level. But if you aggregate it, it means that if you look at the GDP contribution of good health in terms of productivity, even in terms of how we spend for diseases and sickness that comes from lack of early care, early warning, early detection, it means that down the line, you'll be spending more to deal with very serious contagion, very serious ailment that should have been controlled with access, basic access to healthcare. So the point is, look, healthcare is a major strand for human development, but also for economic growth in the medium to long term. So Nigeria is losing at both ends because people are probably dying more. If you look at the death rate, it will be probably higher where there's less access to Medicare, and of course, productivity will be low.
Yeah, Professor Sam AMADI, what is the way out? It's like the damage is getting extensive.
It's funny. We always call for emergency, declaration of national emergency, everything: security emergency, education emergency, healthcare education emergency. So maybe at this point, there should be some level of moratorium on strikes. I don't think, that's the truth about it. The doctors need to be paid well, but it's a massive strike of this scope at this point, with the damage in health infrastructure, with the restricted access to Medicare, would be a major, major crisis, both on the level of human loss of life and the level of the economy. So I think the government should work harder to head off this crisis, get back to the negotiation, do their best to make sure that they meet the demand of NMA. And of course, the doctors, too bad to say, but look, these guys are suffering a lot and being paid less. But again, this is essential service. That's why it's called essential service. Maybe we could appeal to them to be much more less disposed to down to, even in the face of very excruciating.
But they were warning strikes prior to this extensive one. I remember this is the third time they're going on strike this year. There were some agreements between them and the government, yet the government has not actually played its own role. The government is saying that
their demand is most unrealistic or outrageous.
Well, we had a doctor yesterday, we spoke about the Hippocratic oath, but he says, you know what, they have to feed themselves,
they do need, but
so what policy options are available now, beyond putting a state of emergency on, the healthcare sector?
I think first is that we have to have a realistic health financial scheme and policy. For example, do we need to provide a special tax for health care? We talk about special tax on education, the ETF, and so on. Is there time now to have a special tax on health? Now, the question will be, who would this incidence of tax fall on? Is it on the same brutalized poor Nigerian, or are we going to tax companies that are already facing massive taxation? But the problem is that you must find the financing to address these critical bottlenecks and provide improved welfare for doctors and incentive for work. See, professionals are not talking about only stomach issues. They're talking about working environment. They're talking about research, incentive for them to keep updating their knowledge. That's what I call knowledge workers. So don't just pay salary. Think about the whole environment in which they practice their trade. And that's why you need a special financing, maybe a special tax will help. Yeah.
Good place to leave the conversation.
Absolutely.
Dr. Sam AMADI, Arise News analyst, thank you so much for that update.